Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A physical therapist evaluates a pediatric patient using the Modified Ashworth Scale. Which condition would least benefit from the use of this tool? Option 1, Hypotonia. Option 2, Hyperreflexia. Option 3, Spasticity. Option 4, Rigidity. It's time to start seeing your skills not just as a career, but as the foundation for something greater. The Entrepreneurial PT podcast is designed to help you explore new possibilities beyond traditional practice and discover what's truly possible when you think like an entrepreneur. If you're ready to take control of your future, expand your impact, and create a career that fits your vision and values, the Entrepreneurial PT podcast is for you. Warning: the question states least benefit, meaning which condition would not benefit from the use of the Modified Ashworth Scale? The Modified Ashworth Scale is a widely used qualitative scale for the assessment of increased tone, for example, hypertonicity, spasticity. It measures the amount of resistance to passive stretch. Spasticity is not a primary condition, but a secondary effect from central nervous system damage. Modified Ashworth Scale, grade 0, no increase in muscle tone. Grade 1, slight increase in muscle tone manifested by a catch and release or by minimal resistance at the end of the range of motion when the affected part is moved in flexion or extension. Grade 1 plus, slight increase in muscle tone manifested by a catch followed by minimal resistance through the remainder less than half of the range of motion. Grade 2, more marked increase in muscle tone through most of the range of motion, but affected part is easily moved. Grade 3, considerable increase in muscle tone, passive movement difficult. Grade 4, affected part rigid in flexion or extension. Let's explore each of the options. Option 1, Hypotonia. Hypotonia is defined as a decrease in expected tension within a resting muscle or the amount of resistance to stretch that a resting muscle possesses. The Modified Ashworth Scale does not evaluate diminished tone. A grade of 0 indicates normal tone, and a grade of 4 indicates rigidity found in flexion or extension of a body part. Option 2, Hyperreflexia. Hyperreflexia refers to hyperactive or clonic reflexes. Patients that exhibit hyperreflexia may also experience an increase in skeletal tone. Clinical assessment of hypertonicity will typically include use of the Modified Ashworth Scale, muscle grading, deep tendon reflexes, and range of motion evaluation. Option 3, Spasticity. Spasticity is a component of an upper motor neuron lesion, which is also characterized by exaggerated phasic tendon jerks and tonic spastic stretch reflexes that can occur after injury to the central nervous system. The Modified Ashworth Scale is used to assess the degree of spasticity with assigning a grade of 0 to 4 based on resistance to passive motion. Option 4, Rigidity. Rigidity is a state of severe hypertonicity where sustained muscle contraction does not allow for any movement at a specified joint. A patient that presents with rigidity would be evaluated with the Modified Ashworth Scale and receive a grade of 4. The correct answer is option 1. Deductive reasoning strategies. If you lack the necessary academic knowledge to answer this question correctly, you may have been able to increase the probability of identifying the correct option using deductive reasoning strategies. Option 2, hyperreflexia, option 3, spasticity, and option 4, rigidity all deal with increased tone, while option 1, hypotonia, is characterized by decreased tone. Voila! Don't use deductive reasoning strategies when you possess the necessary academic knowledge to correctly answer a question. However, consider employing this strategy prior to random guessing. Let's explore the all-student data. 51% of students selected option 1, hypotonia, the correct response. 36% of students selected option 2, hyperreflexia. 3% of students selected option 3, spasticity. 10% of students selected option 4, rigidity. System classification. This question is a neuromuscular and nervous systems question, which represents approximately 24% of all exam items. Content outline classification. This question is a physical therapy examination question, which represents approximately 24% of all exam items. Level classification. This question is a level 1 question since the question requires students to possess basic foundational academic knowledge. Remediation of level 1 questions occurs through academic review of entry-level content using textbooks, review books, Basecamp, and flashcards. Academic focus area. Looking to review related academic content? Check out page 274 in PT Exam the Complete Study Guide. Thanks for joining us on the Score Builder's question and answer video session. See you next week.